सो आज ज्ञान की उल्टी करने आए हैं, ठीक है। तो ये उल्टी आपको लेके जानी है और इस उल्टी को आपको यूज करना है. सो टुडे देयर इज एन इम्पोर्टेंट अनाउंसमेंट. फर्स्ट जो चीज़ें डिस्कस करेंगे दैट आई विल समराइज. सो देर आर 3 cases. One is a case of acute situation, acute diarrhea, or you can say acute dyspepsia, whatever diagnosis you label. And in that there is a important rubric. From that we are understanding a whole new remedy. And there are another 2 cases which have been given, which have been prescribed by a single remedy. So there are 2 remedies which we will learn today. So it is a, I think when I was reading, even I was thrilled. So I would very much like to share the experience with you. So we pay our respects to Dr. Henman sir, who has given us wisdom, who has given us knowledge. And next to Henman sir, our Guru, Dr. Vijayakar sir, who has trained our immature minds, who has given us a thought process for each and every patient coming to us. And he has given us such confidence. So now we are able to prescribe confidently. If you recall the way of prescription few years back and the way we are prescribing now is totally different. And it is different and it is innovative. That is important. So he has taught us the innovation. Then my guide, Dr. S.K. Tiwari sir. My guide, Dr. S.K. Tiwari sir, who has inculcated in me the spirit of homeopathy, who taught me the basics of repertory, when to use repertory, which repertory to be used in which situation. So that wisdom has come from him. So my naman to sir. Today there is an important announcement also. We are naming our group, and I name our group as the Cooper's Club. Okay. So we are naming our study group as the Cooper's Club. Why? Because Robert Thomas Cooper, he was the homeopath who was a turned homeopath. He was basically an allopath who turned into homeopathy, and he became a physician for disease of the ear at London Homeopathic Hospital. He was treating ENT diseases in London Homeopathic Hospital, and he was a member of British Homeopathic Society from 1869 to 1896. So he used to do discussions with his fellow doctors. He used to arrange meetings and they used to discuss, they used to share their experience, they used to learn. So there were these informal meetings among the influential homeopaths in UK. And so that club was called as the Cooper Club. So on the same thing, because we are a group of homeopaths and nobody is small. Delusion small is not applying here anywhere. So in the group, the prominent members were Thomas Skinner, James Crompton Burnett, John Henry Clark. Such eminent people were there in that group. So they used to discuss and they used to write books, they used to write literature, they used to do provings. So on the spirit of Robert Thomas Cooper. I name our group as the Cooper's Club. Here on, we will be called as the Cooper's Club. So, today's case, coming to today's case, this is making sound. So, this 65-year-old lady, she came with acute dyspepsia, loose stools. She seemed very uncomfortable and in anguish. She said, "Doctor, I am having this pain and gas in the abdomen, and it is causing lot of discomfort, and I am not able to do anything." डॉक्टर साहब कुछ समझ में ही नहीं आ रहा है क्या हो रहा है मुझे. That was the expression given. And sir, इतना पेन, इतना discomfort, तो I am not good at expression, but that was the expression she gave me. This is the case. This is the case, and you have to prescribe on this. But first, I would like to give the follow-up video. For this video, I am not putting in the social media, so I would like to pause the recording. Hours, the pain became 50%. चालू करो. So so after the remedy, pain became 50%, and that discomfort and everything was gone. So the follow-up was the case. This much was the case on which I prescribed. So what is the analysis of this situation or this case?
I think you must be described a mental status of confusion.
One aspect is confusion. और कोई opinion?
I suffer mentally.
हाँ. Anguish. और क्या? ये क्या हुआ? पॉज कर दो एक बार. So, how do we analyze? So, first is anxiety. Second interpretation. First is anxiety, anguish, then confusion. This is not working. Stop. First interpretation is anxiety. Second interpretation is despair. What is happening to me? Then third is anguish, as you all said. Then another is restlessness. She was very restless. What is happening? She was not understanding. Then analysis. It's very slow. Is in a state of acute distress. This is for sure. This is our analysis. Second, so she was very restless. She was not understanding what is going on. So this lady was in a state of distress, and this distress is because of discomfort in the stomach or abdomen, and this distress has acutely disturbed the psyche. This is also there, and psyche has become unbalanced. She is saying that मुझे समझ में नहीं आ रहा है कि क्या हो रहा है. So is it delusion or is it a delirium? It is delirium, definitely. So let's find out the delirium here. ढूंढो क्या delirium है?
Shaking.
Hmm.
Delirium shaking.
Delirium shrieking or
Delirium pain from.
delirium pain from और पेन तो है, किसका पेन? एब्डोमेन का. तो डिलीरियम को एब्डोमेन से कनेक्ट करो. So the delirium is, there is acute complaint from abdomen causing this delirium. So the delirium should be linked to that condition. ठीक है? Mind delirium, distension of abdomen and constipation with acetic acid. ठीक है? This is one delirium which is slightly fitting to the condition, but there is no constipation here. So the apt rubric is delirium distended abdomen with, delirium swelling of abdomen with. The remedy is acetic acid. Okay, so this was the case of acetic acid. 200 single dose was given. Our follow-up video you have all seen. So after giving, within 2 hours 50% pain was gone. Now only slight prostration weakness is remaining. All the more she is fine. So about acetic acid, we'll learn about acetic acid today. So acetic acid is a remedy for wasting disease like tuberculosis, pernicious anemia, cancer, AIDS, all old opium users, narcotic abuse. Stomach as if full of sour vinegar, like the remedy. If you have taken vinegar, that soreness which you feel in the abdomen, there is a feeling of intense soreness in the stomach. Impotency from weakness, lying on the back is impossible. And this is a keynote for acetic acid. Why lying on back is impossible? I am not able to find out the reason why it is impossible. Throat swallowing impossible, liquids anything but teaspoon full of even. So even a slight teaspoon of liquid is not able to go inside. So this is physical symptom of acetic acid. Then cancer pylorus, very important remedy of cancer pylorus. Okay, few of the remedy for cancer pylorus, among them acetic acid is the remedy. So stomach, vomiting, milk after mothers. This is also there. After mother's milk, acetic acid vomits.
Accusa में है मेरी तो
इतुजा में भी है. Abdomen, bleeding intestines accompanied by undigested stool. So there is hemorrhagic tendency in acetic acid. So bleeding from intestines. Then pain, lying abdomen on ameliorated, burning. So when lies on the abdomen, burning is ameliorated. Rectum diarrhea accompanied by anasarca. See, everywhere you notice one thing, there is accumulation. Okay? The body is trying to accumulate. Whatever fluid is being leaked from the system or from the blood, it is being accumulated. So that the rotation of blood or the circulation is not proper. Diarrhea, tuberculosis during. So during tuberculosis, there is diarrhea. Hemorrhage from the anus, from menses suppressed. So there are only 4 remedies. If you suppress menses and then you get bleeding from the stools. So there are only 4 remedies. Acetonuria. Acetonuria means ketonuria. Old terminology was acetonuria. So when there are ketone bodies in the urine, acetic acid could be one remedy. Chest abscess, breast threatening in old cicatrices. So in old, if there are old wounds, so they tend to open up. ठीक है, old wound means it could be anything. If a lady was hurt long back and the same hurt again comes up, that is the interpretation of old hurt. So that same hurt causes now problem. Chest angina pectoris, so it is also a remedy for cardiovascular system, for coronary arteries. Chest bronchiectasis, it is again a remedy for bronchiectasis.
Bronchiectasis means वो है जो
Elasticity,
ILD वाली जो condition
yes,
होती है,
yes,
alveoli जहाँ restriction होगा,
later on.
डायरेक्ट डुप्लीके ILD के लिए अपन ये ले सकते हैं क्या?
ILD is different thing. Bronchiectasis is,
अल्टीमेटली तो वहाँ alveoli का restriction हो गया है।
no, there is the reversibility of the air tract are compromised. Okay, distal emphysema and bronchiectasis, these are the two entities. So where the elasticity is being compromised. So this is one remedy for bronchiectasis. So hemorrhage of lungs. Sleep position back on impossible. So on the back there is almost impossible. Why? Because back is sensitive. So back is a supporting organ for you. So maybe acetic acid has some problem with the support in life. So that is why it is sensitive. So skin cancer. Out of 19 remedy of skin cancer, one is acetic acid. Condylomata flat, only remedy is acetic acid. So when there are flat condylomatas, acetic acid is the remedy. Important is the waxy look of the skin. That you know, that oily look. Some people have that waxy look. So for that, acetic acid is the remedy. General's anemia accompanied by respiration difficult. Anemia with respiration difficult. Total 3 out of 3, acetic acid is the remedy. Then anemia accompanied by weak heart, acetic acid. When there is anemia and the effect is on the cardiovascular system, so that is acetic acid. Anemia, nursing mothers. If the female is nursing, she gets anemia, so acetic acid is the remedy. Atrophy of muscles, even the muscles are become atrophied. Autoimmune diseases, so acetic acid can reach up to autoimmune disorders. So it is very syphilitic remedy. Psychosis is almost absent, so it is a soro-syphilitic remedy. Cancerous affection epithelioma. Generals chancre, soften and cause formation of pus is acetic acid. When there is a pus formation in the chancre, then the remedy is, only remedy is acetic acid. Chloroform ailments from, if some people have problems after anesthesia, you can give acetic acid. As a side effect, some people they have this problem, so you can prescribe. Collapse injuries from acetic acid. After injury, if person collapses, acetic acid. Convulsions alternating with relaxation of muscular system. There is convulsion and followed by the muscles are totally relaxed. Very peculiar thing. Only remedy is acetic acid. ठीक है कि डॉक्टर साहब इसको तान आती है, तान आने के बाद में एकदम ढीला हो जाता है, ये जैसे इसकी बिल्कुल ही लूज. दिस इज एसिटिक एसिड एंड दिस वी हैव सीन ऑलवेज. सो रेमेडी इज एसिटिक एसिड. माइंड में एसिटिक एसिड में बहुत कुछ नहीं मिलेगा. फिजिकली अपीयरेंस आप देखोगे फेस का, दैट विल गिव यू अ हिंट, यार ये वैक्सी फेस लग रहा है, वैक्सी फेस लग रहा है.